So Mr. Velez gets here to Hadassah, and we notice he has two fractures. He has one in the cervical spine and one in the thoracic spine. The one in the cervical spine, and this is because of a condition he has in his back that causes his spine to be quite rigid. And when he bumped it, he broke it in two places. In a discussion of what to do with him in surgery, in a classical surgical procedure, we have to first of all stabilize the neck and then move on to the lumbar spine. Doing that, we need to put him to sleep when he's awake, or do what we call an awake fiber optic intubation, which is a very difficult and dangerous procedure, because if he moves his wake in the time where they put the tube in, he might become quadriplegic. So in order to avoid that, we put together the team that was able to have surgery on him when he's awake. The cervical spine, as long as he's up and awake, is stable and is sitting in place, and there's no risk involved by leaving it that way. However, when we put him to sleep, the muscle tones decrease and he might become quadriplegic on the spot. So we put a team together, which we're using the new Angie suite up on the 12th floor of the hospital, with Professor Jose Cohen as my partner, myself, Dr. Hashim Ruchi, who's a great anesthesiologist, who's brave enough to take the patient and keep him awake. We have a great team of nurses, techs, and everyone together with my fellow, Dr. Ahmed, we decided to take him to the operating room and stabilize his thoracic spine, which was broken in two. When the patient is awake, we got to work very quickly. So we got to take a long procedure, which would take us in the operating room between 1 to 2 hours, and really shorten it down and work as quickly as we can because the patient is awake. We got to use some local anesthetics and mild sedation to keep him breathing on his stomach, and make sure he keeps his muscle tone together so he doesn't run into any trouble. And with that, to do the procedure as quickly as possible. The procedure takes between 15 to 25 minutes, depending on the complexity of the procedure. Now we're conversing with them. Move your legs, move your arms a bit. He's with us, both out us. You know, it's like I'd say like in a mildly drunkish kind of position where it's not painful, but he's in total control of his body. He's going home tomorrow. He's great. He's up. He's walking. He has a beautiful X-ray, as we can see over here, with a stabilized spine, with cement and spherical screws, everything done percutaneously. He's walking. He's going to be flying back home with his beautiful wife, back home to Colombia to continue his life over there. Hadassah is unique that we're able to combine teams from different worlds. We're able to bring in the neurosurgical teams and the orthopedic teams together with anesthesiology and really invent this procedure. This procedure is not done anywhere else in the world. So we're pushing medicine forward for the benefit of our patients, if they're local or if they're foreign, and we're happy to do the best we can.